Hey guys, how's it going? Today I want to talk about this book, Language in Thought and Action. It's a book written by S.I. Hayakawa. I want to relate a lot of these topics to dentistry and how language relates to our day-to-day interaction with our patients. S.I. Hayakawa was born in Canada. He was of Japanese ancestry, and he was a college professor at San Francisco State University, where he became president of the university, and then he went on to become a U.S. Senator for the state of California. After Hayakawa's passing, his son Alan Hayakawa took over his book and the information. He revises all the information, and he keeps this book in print, which is a fascinating book. It's a hidden gem. If you haven't read it, then I suggest you do. So let's go ahead and get into the presentation and relate this book to dentistry. So let's go ahead and get into the presentation here, Language in Thought and Action. The book is by S.I. Hayakawa, and it talks about many concepts of language, including discussing the role of human language in human life, the many functions of language, and how language can sometimes, with or without our knowing, shape our thinking. This presentation talks about how they apply to dentistry. Advertising and intentional orientation. Many advertisers prefer that we be governed by automatic reactions to brand names rather than by thoughtful consideration of the fact about their products. There are many large corporations such as Amazon, Google, Tesla, Apple, or Microsoft. Right away, when we think about these companies, we think about their logo, we think about how the companies are run, we think about the services that they provide or the products that they provide, and we think about whether it's a good company to work for. If somebody tells you, "Hey, I work at Tesla," you think, "Oh, that's really cool," because we know that they treat their employees well, and that's a good thing. So we like to support companies like that. Same goes for dentistry. We need orientation that relates to the customers. So we need to portray a good logo. We need to portray a good working environment. When the patient's in the chair, you don't want to have um, outside personal conversations going on. Everything should be related to the office and to the patient. Um, Delivers information about office and technology. So when a patient thinks about your office, are they thinking about the traditional X-rays that you're using, or are they thinking about the digital X-rays that you use, or the paperless charts? Do they fill out their medical history on paper, or are they using iPads now? Those are all the type of things that we need our patients to think positively about our office. And these things can make the dentist not so bad. It makes the idea of going to the dentist not so bad because technology has improved the quality and manner in which we treat our patients. Survival of the fittest. The fittest are those who can bring to the struggle superior force, superior cunning, and superior ruthlessness. So just like in evolution, we need to keep our offices fit so that they can weather a storm economic downturn, or so that as competition gets more tight, that our office can survive, our brand can survive, and we can continue practicing and treating our patients. So we need to adapt to the environment. If things are changing in the industry, we need to get on it, we need to research it, and we need to apply it if it fits into our practice. Technology, we want to stay on top of the latest x-rays. We need to start using paperless charts. And there's one thing to say, hey, I'm gonna change the paperless charts, but what is your plan? How are you know when is the date that you're going to change to those charts? You can't just keep kicking you know kicking that over a month, a year, and eventually you never change. Um, we can start to advertise same-day crowns if that's what we're doing, and if not, that's fine. But if you do services that are not done by everybody else, then sure, why not, you know, talk about those. You want to use quality materials. An office cannot survive if you're using cheap materials or cheap labs, and the patients keep returning with broken restorations, broken, crowns, or work that wasn't done correctly due to the materials. So you want to, from the beginning, use good materials so that they can last many years and you can have good referrals for many years. Above and beyond customer service. This is a very important one, and if, from the moment a patient calls the office, if it's their first time or if they're returning patients to schedule an appointment or ask a question, they can tell whether the employees there are happy to be there, if they're tired, or if they're not happy to be there. So, your front office is very vital to this. If a patient walks in through the front door, are they welcoming them by name? Are they asking them whether they're thirsty? Would they like something to drink? Or if their appointment is at that moment and the doctor is behind about 30 minutes, then you need to let the patient know that your appointment is right now, but the doctor is running behind maybe 20-30 minutes. If you would like to take a walk outside, or here's a $5 gift card, there's Starbucks next door, then that is acceptable. But communication with the customer is very important. Another really cool above and beyond service that I've seen is that first time patients, they get a tour of the office. So, once they come in, they fill out their paperwork. Before they get seated into their chair, they get a tour of the office, including the lab, including the sterilization, and all the operatories, so that the patient is familiar. If this also helps if there's an emergency, they know how to exit the building and where the restrooms are, and they see the cleanliness of your office. Availabilities for Saturdays. This is a big one. As more and more, dental offices are opening in condensed areas, availability is very important. Your office will survive if you sacrifice a little bit of your weekend to see patients that can only come on the weekends. If not, then you will be losing out on those patients, and they will be going elsewhere. Quality is non-negotiable. So this is a big one also. Um, Along with your reputation, you need to sometimes put your foot down and not negotiate with quality, because sometimes if you have a patient that had a crown done maybe 10, 15, 20 years ago and it keeps falling off, and you didn't do the crown but they keep coming back for you to re-cement the crown, and you keep telling them they need a new crown but they just want to get it re-cemented, then at some point you're gonna have to tell this patient, I'm only gonna re-cement it this one time, but after that, if it falls off again, then you're gonna need to get this treatment done. Or if there's a very large cavity and you're recommending a crown, but the patient wants a filling, due to financial reasons or whatever the reason may be, um, you need to let them know that you don't want to place the filling because you know that it's going to break and it's going to cause a bigger problem in the future. So you need to be able to talk to patients in this way. Competition is not everything. So, with the survival of the fittest, I don't want you to think that it has to be a cutthroat profession. You don't need to talk bad about the dentist that is doing things a little bit old school, or the office that's not as up to date as yours. Species that have developed elaborate means of intraspecific competition often make themselves unfit for interspecific competition. So within our profession, you want to be the best that you can be, but do not forget that we are in the bigger, realm of medical professionals. And so, you need to stay on top of things within dentistry, within, your immediate functions, but you also need to start looking at other, um, functions that you can be doing in order to make yourself an essential um, part of a patient's care, medical dental care. So we need to focus on whole body wellness. If a patient is suffering from TMD, sleep apnea, myofunctional growth, we need to know how to treat those. If a patient has is suffering from sleep apnea, are they going to go to you or are they going to go to their primary physician? We as dentists, we can treat sleep apnea. There are many other um, conditions that we can treat, but patients don't see us as their primary, you know, contact for those conditions. So um, we need to research those, we need to study, we need to practice those, so that we can be, we can come to mind when a patient is suffering from that. So, how do you start? So you start by collaborating with the other medical specialties. If a patient has heart disease, you want to call their cardiologist, quick call to see, hey, how's the patient doing? Um, are they controlling their blood pressure? Are they, what's the end goal for your treatment? What are you guys recommending? How is dental treatment going to affect, the treatment that you guys are doing? So this goes for a lot of other specialties, including, gynecology, pathology, oncology. Um, a, a medical billing is also a very big one that is going to help you um, stay competitive within the medical field. More and more treatments are being charged under medical billing. So if you're getting wisdom teeth removed, if you're doing wisdom teeth removals, surgeries, if you're doing CT scans, things like that, you want to train your front office to do medical billing. Of course, at first it's going to be a pain and it's going to be a learning curve, but once the processes are in place, then it's going to be normal, and you'll be happy because you'll be being compensated as you should for these procedures from the medical insurances. In the chair, when we are questioning the patient about their medical history, whether it's their first visit or whether they are returning patients and we're following up on their medical histories, there's verbal taboos that we need to be careful of, and but we still need to address. In every language, there seems to be certain unmentionables with words of which strong affective connotations that they cannot be used in polite discourse. So if there's if we're going to take x-rays on a woman and she is of childbearing age, uh, then we need to ask, are you pregnant? Um, it may seem a little taboo, but it's important because, a lot of patients come in for the first time. A lot of patients we haven't seen in years. So we need to know whether things are changing, and so that we do not hurt the patient and that we do not risk ourselves from a lawsuit. So we ask, are you pregnant? Things like genital or oral herpes are pretty taboo. Asking a patient, do you have HIV or AIDS? In the medical history, sometimes they put down that they have a sexually transmitted disease, but we don't know which one. So we need to pinpoint which one it is so that we know what precautions to take. Do you use controlled substances? Um, there are reasons why we need to know this. maybe the patient is a recovering addict. We don't want to prescribe a medication that's going to, affect their recovery. Embarrassing medications like antidepressants or Viagra, those can be pretty touchy medications that the patient might not want to write down, but we need to know because they affect treatment. A question directed towards us, the practitioners: how much money do we make? I've been asked this by quite a few patients. Depending on the situation, sometimes it's a patient that wants to get into the field. So if the patient wants to become a dental assistant or a hygienist or a dentist, then I'll give them a range and say, oh well, I've seen assistants start from this range, and the highest that I've seen is this range. Same goes for hygienists. So you don't have to tell them an actual, how much you make, but it's okay to give them a range. So this doesn't have to be taboo. Verifiability. Even in a world like today's, in which everybody seems to be fighting everyone else, we still to a surprisingly degree, trust each other's reports. So, um, like it says, in today's world, there's so much going on, but we have to trust our patients, and they have to trust us. We have to create a relationship of trust. So in the medical history, a patient is expected to be truthful when reporting any existing medical conditions, allergies, or prescription drugs. So this is very important to be able to have that trusting relationship with the patient. Inferences can also be made. A physician making an initial diagnosis examines a patient's symptoms, then makes an inference about an intestinal condition that cannot be seen. So in dentistry and in medicine, we make a lot of inferences because a lot of these conditions are not like tested for. We usually see the signs and symptoms in the mouth or on the body, and those are the things that let us know whether a patient can be suffering from, a pregnancy gingivitis, a carcinoma, things like that. Um, so oral health is directly related to overall health, and unhealthy gums can be a sign of diabetes, heart disease, or even precursors to Alzheimer's disease. We need to let the patient know of these things. It is our job to let the patient know. Just because we're friendly with the patient doesn't mean we need to shrug off a lot of these signs that we see. We need to let the patient know so that they can be informed and they can make the decisions that they want uh, when it comes to their health. Effective connotations. All words have, according to the use of which they are put, some effective character. So the way in which we say words and the words that we choose can have an effect on how the patient's appointments go. So good connotations can be like using the words like my friend. A patient's sitting in the room waiting, and you walk into the room, and you can say, "Hey, my friend, how have you been?" That kind of breaks the ice, eases any tension that there might be of the patient being in the dental chair. With kids, we can say the words, "You'll get a prize if you sit still during while we brush your teeth with the spinny brush." And you'll be surprised to see how kids react to that. Bad connotations: if you tell the patient, if you don't brush, you're going to get cavities. Cavities equal bad, right? If you don't take care of your cavity, you're going to get a root canal. You're going to need a root canal. That's bad. The longer you wait to treat this, the more it's going to cost you. That's bad. And using words like needle or injection are not, they're bad connotations because they are related with pain. Delusional words. Some people, for example, as a result of a childhood experience, cannot help being frightened by the mere sight of a police officer, any police officer. The terrifying police officer inside their head is the delusional police officer outside, who probably has no designs that anyone would regard as terrifying. So at the end of the day, we need to remember that if, a dentist is a human being, a police officer is a human being, whether male or female, they're just a person. If there are many patients who had bad experiences throughout their childhood, especially before technology had reached this level to where we can do procedures without causing much pain. So this is an example of a Yelp review, and it says here, "This is long overdue. This dental office has completely changed my perception of the dentist. I've been terrified since childhood." And so this lets you know that the patient had an idea, had a perception of the dentist before she came in, and fortunately, we were able to take away that notion and replace it with good memories, good thoughts, so that she can continue to get her treatment. Noises for noise's sake. There are numberless of daily situations in which we talk simply because it would be impolite not to. So it says here, a great receptionist can create rapport with patients and make a wait seem brief. Have genuine conversations with patients while they are in the chair. And during treatment, break the silence by asking questions that make sure that the patient is comfortable. So there are many situations in which there's silence. Take that time to make sure that the patient is okay. Make sure that the patient is informed about what's going on, and it kind of breaks the silence, and it makes everybody more comfortable. Sometimes the awkward silence is just that. It gets a little awkward, and so you just want to take that moment, take advantage of that moment, and make sure that the patient is okay. A matter of degree. Physicians do not lump all people together into two classes of the healthy and the ill. They distinguish an indefinite number of conditions and an indefinite number of treatments for them. So when talking simply about periodontal disease, there are many, many classifications. There could be acute, chronic, early, moderate, severe. We could talk about the bleeding. We could describe the gingiva. So, one patient, we can say one patient has gingivitis and the other one has gingivitis, but they are not the same. So we need to use language to describe those different classifications, and we have to inform each patient of their classification, why we came to that conclusion, and how to help that patient. So telling a patient, "Oh, you have bad gums," is not very effective in educating the patient. It's not effective in getting the message across. It's not effective in diagnosing the patient. So you want to take the time, explain the, the level of condition to the patient so that they understand where they stand and where they can go, whether it's healthier or worse if they take care of their condition. And this is language in thought and dentistry. Alright guys, thank you for watching. If you have any questions or comments, please leave them below. I hope you guys learned a little bit about how language and dentistry can be related and how important it is to get the right words out for the patient so that they can have a good experience and good thoughts about dentistry overall. If you have not yet, please subscribe down below. Thank you and have a good day.